Hi, my name is Tawny and I'll be your student nurse today. I'm going to go ahead and do hand hygiene, and I've closed the door behind me to ensure your privacy. Can you tell me what your full name is?
Tawny Dore.
Okay, and your date of birth?
August 30.
August 30. Okay, and I've reviewed the doctor's orders that we have for today's assessment, as well as gathered all of my equipment. So today we're going to be doing an assessment of the heart and peripheral, and I just have a few questions for you before we get started on the actual assessment, okay? Do you have any pain today anywhere?
No.
No, okay. Do you take any medication? Okay. Do you have any allergies? Okay, and do you know where you are right now?
Yes.
Where are you?
Mommy's room.
Okay, very good. And by those responses, it tells me that you are alert and oriented to where you are. Are you having any chest pain today?
No.
Any shortness of breath?
No.
And do you smoke cigarettes?
No.
Okay. Do you exercise?
No.
And do you drink alcohol?
No.
No. Okay. And do you have any history of hypertension or diabetes in your family?
No.
No. Okay. All right. So before we get started with the physical heart and peripheral vascular assessment today, I'm going to have to touch you. Is that okay to touch you?
Mm-hmm.
And I may have to lift your shirt up a little bit just to palpate and auscultate. Is that okay as well?
Yeah.
Okay. Go ahead and lay down on the bed. Okay. And I'll just have you lift your shirt up over your chest. Yep. Okay, and I'm just going to first inspect your skin a little bit. Your color looks very good. It is very appropriate for your ethnicity. I don't see any signs of cyanosis or pallor. I don't see any lesions, any bulges, or any masses or anything like that. And I'm just going to feel your skin for your temperature. Is that okay? Okay, your skin is warm to the touch and dry and very much intact. Okay. And now I'm going to go ahead and inspect your apical pulse, which is on your 5th intercostal midclavicular line. And I'm just going to inspect that. Okay, and I don't physically see your apical pulse, which is normal. No indications of lifts or heaves anywhere. Okay, and now I'm going to go ahead and I'm just going to feel for your apical pulse, okay? I'm going to put my hands on you. Is that all right?
Yeah.
Okay, so I'm just going to feel for your 5th intercostal midclavicular space, okay? All right, and can you go ahead and just roll your body over this way? Yep, just roll over halfway, just a little bit. Right there is good. Right there is good. And perfect. You can lay back down. And I did not have any indications of your apical pulse, which is normal. No signs of lifts or heaves anywhere. Okay, and next I'm going to move on to the auscultation of the different heart sounds. And the different heart locations that I'm going to be looking for is the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral sounds. Okay?
Okay.
And I'm going to go ahead and listen to all these sounds with the diaphragm of my stethoscope here. So if you would, go ahead and lift up your shirt one more time for me, okay? All the way up. Okay. And the first one I'm going to be listening to is the aortic pulse, which is on the left, 2nd intercostal space. Okay, and then I'm going to move over to your pulmonic, which is going to be on your right second intercostal space. All right, and then I'm going to move down to the third intercostal space to your Erb's point pulse. Very good. Now I'm going to move over to your left side, which is going to be your tricuspid pulse in your fifth intercostal space. Okay. All right, and then I'm going to move over to your fifth intercostal space where the mitral pulse will be found in the midclavicular intercostal space. Very good, and you can stay laying down. And I'm just going to let you know what I'm going to be doing next. Did you have any pain or tenderness during any of that?
No.
Okay, now I'm going to move on to back up to your apical pulse, the very first heart sound that we listened to. I inspected it, but this time I'm going to listen with my stethoscope for 1 minute. Okay? All right, so just relax. All right. Okay, and I counted your pulse at about 33 pulses per minute, and I believe that's because of your age, you being so young and such. So what I was looking for actually was the S1 and the S2, which is the two sounds that the heart makes. S1 is the lub, because the heart, when it makes the sound, it sounds like lub-dub, lub-dub. And the lub is the S1 and the dub is the S2. And the S1 is the beginning of the systole, and the S2 is the end of the diastolic pulse. A sound very normal. Okay, and now you can actually sit up. You can put your shirt down and sit up for me. We're going to inspect a few more things. You can move your legs this way and put them down on the edge of the bed if you'd like. Nope, sit up. You're good. Yep, just like that. Perfect. Okay. I'm just going to move your hair back. All right, so now I'm going to inspect your neck veins. So I'm going to inspect your jugulars on both sides of your neck for any signs of distension, okay? So just look straight ahead at me. Okay, I did not see any indications of any distension. And now I'm going to go ahead and feel on your carotid arteries, which is also right where I was looking, right on both sides of your neck, okay? So I'm going to feel on this side of the neck first, okay? Just relax. Very good. Now I'm going to do the other side. Very good. Okay, and both pulses were bilaterally normal, 2+, which is very normal. And now I'm going to listen in 3 different areas on your neck, okay, for any bruits, okay? So if you could sit up straight for me. Go ahead and sit up straight. You can stay sitting. Just make sure you sit on the bed. Sit on the bed, Sissy, please. Thank you very much. And I'm going to listen in these 3 different areas on the bell of my stethoscope on this side, okay?
Okay.
So the 3 areas I'm going to be listening for is right under your jawline, right in your cervical area, and then right at the base of your neck, okay?
Okay.
All right, so I'm just going to move your hair back, and I'm going to be listening for bruise, okay? While I'm doing this, I need you to take a big, deep breath and hold it in like this. Okay? Hold it in until I get done with all 3 areas, okay? Do your very best. And hold your breath as soon as you feel my touch, okay? And breathe in. And hold your breath. Very good. Now go ahead and let your breath out. And you can take a deep breath and breathe for a minute until you're ready to do the other side.
Okay.
Okay?
Okay.
Are you ready?
Yeah.
Okay, when you feel the bell touch your neck, that's when you want to breathe in and hold your breath. Okay, ready? Breathe in and hold it. Almost done. Very good. Okay, very normal sounds, no signs of any bruise or anything. Okay, so my next step is going to be inspection of your upper extremities, which is just the upper part of your body, okay? So I'm just going to be looking at your arms. So go ahead and lay your arms out like this. And if it's okay to touch you, I'm going to roll up your sleeves. Is that okay? I'm going to roll them up. That's okay, right? Okay. Okay. I'm going to roll them up. All right, so inspecting your upper extremities. I'm looking at your color. It's very appropriate for your ethnicity. I see your hair growth is very even and normal. It's evenly distributed. Now I'm going to feel your arms for your temperature, okay? Go ahead and lay your arms down. Okay. And your skin is very warm to the touch. And now if you could hold out your arms for me just like this with your wrist facing up. I'm just going to press on your skin to check for any edema. And that means when I press on your skin, it will stay sunken in like a little bowl, okay?
Okay.
Sorry. Okay, and this side. Okay, no signs of edema. And now I'm going to move on to your fingertips, okay? I'm just going to pinch each fingernail like this. It's called capillary refill. Do you want to see something neat?
Sure.
Hold your hands out like this. Hold your hands out like this. Thank you. And I'm going to check your capillary refill. So watch your fingers. So when I pinch your thumb, see it's white and then it turns red again. See that? All right, and the other hand. And last one. Very good. So I noticed that your blood return was very quick, less than 2 seconds, which is very normal and healthy. And now I'm just going to move on to your radial pulse. So your radial pulse is right here on your wrist. Okay? Yep, so go ahead and hold out both arms like this, and I'm going to feel both at the same time, okay? Go ahead and relax your fingers. Hold still. Okay, very strong pulse, and they're both equal bilaterally. Okay, and now I'm going to move on to your lower extremities, so you get to relax again. So if you would go ahead and lay down for me.
Okay.
We are almost done, okay? So go ahead and lay your legs down. I'm just going to roll your pants up if that's okay. Is that okay?
Yeah.
All right. Excuse her. Alright, so after I get your pant leg rolled up, I am just going to be inspecting your legs to start. Alright, so I'm inspecting the color of your skin. Your skin color is very appropriate for your ethnicity. Your hair growth is very fine and evenly distributed, which is very normal. I'm going to touch your skin for your temperature now. Okay, your temperature is warm, your skin is dry, and your skin is very much intact. And now I'm going to do the same thing on your legs. I'm just going to press on your tibial area to check for edema, okay? Okay, no signs of edema, which is very good. Okay, now I'm going to move down to your capillary rear foot on your toes. So if it's okay, I'm going to remove your socks. Is that okay?
Yes.
All right. And I'm going to start with your big toe, just like your fingers. And over to the other foot. Okay, your blood return was very quick, less than 2 seconds, which is very normal. And now I'm going to move down to your popliteal pulse, which is under your knee, okay? So go ahead and lift your knee up just a little bit for me. Nope, just like this. Keep your foot on the bed. Yep, bend your knee just like that. Perfect. I'm sorry. And I'm going to feel for your popliteal pulse, okay?
Tight pants.
Okay. All right, and same thing on this side. Go ahead and bend your knee and keep your foot on the bed. Just a little bit. Perfect. Hold still. Perfect. Both pulses are strong and equal bilaterally. And I'm going to move down to your posterior tibular pulse, which is just right on the inside of your ankles there, okay? Okay, so hold very still for me. Very good. And now we have one more pulse to check, and that's going to be on the top of your foot. It's called the dorsalis pedals pulse. So right on the top of both of your feet, I'm going to check one more time, okay? So hold very still for me, okay? Very good. Both pulses are very strong and equal bilaterally. You can sit up. We are finished with today's assessment. So if you don't have any questions for me today or any concerns.
Can I put in my face?
Yes. Yes, you can. Do you have any questions or concerns that we haven't mentioned or talked about today?
No, not really, no.
Okay. Well, you have a good day, okay?
Okay.